Hi, I'm Diane Travers Gustafson, and I'm going to talk to you about careers for medical anthropologists. Medical anthropologists are prepared for positions requiring familiarity with rigorous research skills, both qualitative and quantitative, and the ability to translate emerging scientific knowledge into effective action. Medical anthropologists collaborate in interdisciplinary research and practice teams and may find positions in non-governmental organizations, governmental agencies, private corporations, community agencies, and universities and colleges, to name a few. My education, research, and practice backgrounds are in medical anthropology, public health, and nursing, and I learn and teach from these perspectives. I have found it valuable to integrate these disciplines into my practice. I was hooked in my first anthropology class when the professor described and then illustrated anthropology as the science that studies humankind in all of our aspects. And she went on to say that human and scientific knowledge emerging from anthropologic research is applied to addressing human problems. How engaging is that? It truly engaged me. The human issue I became most interested in was health of people in their communities. Questions quickly arose. How is health understood culturally, and why does it vary? How do health systems work? What are community-defined health needs and concerns? When we compare communities and health systems, what do we learn that improves the potential for health? What I learned studying anthropology framed my experience of living and working in Brazil. In Brazil, I learned from daily experience that health and disease know no geographic or political boundaries, but that the opportunity for health is constructed in society and community by our policies, our politics, and our economics. Thus, we must critically examine these decisions and their outcomes. Paul Farmer, a physician and anthropologist, says, "The idea that the health of every nation depends upon the health of all others is not an empty piety, it's an epidemiologic fact." This is the basis for my practice in medical anthropology and public health. It's what I study and address in practice. So where might you use your training in medical anthropology? First off, I encourage you to explore the professional organizations associated with medical anthropology. You'll meet many people, you'll make connections, and you'll discover job opportunities. As medical anthropologists, though, you will have opportunities to work for the National Institutes of Health in socio-behavioral research, the Peace Corps perhaps as a country administrator, USAID, the U.S. Agency for International Development, the RAND Corporation as a qualitative health policy researcher, the Veterans Administration hires medical anthropologists, universities and colleges for both teaching and research, we mentioned that earlier, and most recently the Pacific Islander Wellness Center in San Francisco, California posted a position for a community-based team leader in their research team. Again, explore your opportunities as a medical anthropologist. They are diverse and many, and you want to practice according to your specific interests.